St. Luke's is hiring 2 pharmacists and 2 pharmacy techs for the Cystic Fibrosis Center. This is thanks to money from the Cystic Fibrosis Foundation, which typically gives annual grants and research grants. This special pharmacy grant aims to take some of the stress out of visiting the doctor.
I think whenever you get the diagnosis of cystic fibrosis, it's a major adjustment.
A major adjustment, which for some means taking several different types of medication a day.
Probably 10 different medications per patient.
The nearly $317,000 the center received is helping keep those patients and their prescriptions up to date.
What this grant really allows us to do is have a pharmacist and pharm tech that manage that for them so that they don't ever run out of medication.
Sabrina Sherwood is the first clinical pharmacist hired for the clinic thanks to the grant.
I see maybe 8 patients on busy clinic days. And in between that, I'm calling pharmacies, trying to get costs down for patients. I'm calling insurances, trying to get medications approved.
Patients with CF need to go for a checkup every 3 months, but they spend hours each day doing treatment.
Having cystic fibrosis, typically your self-care takes anywhere from 2 to 3 hours a day. They don't have extra time to be on the phone arguing with their specialty pharmacy.
Sherwood says patients can go to 4 or 5 different pharmacies for all their medication. She's helped lower that down to 2 pharmacies per patient.
If I'm able to fill the medications, then I know when they're due for refills, and I know these patients better than the other specialty pharmacies do.
Dr. Brown says other clinics with pharmacy programs have seen great results, leading to fewer hospitalizations for patients, meaning less costs to worry about and less of a chance to not fully recover.
Any day spent out of the hospital is better than a day spent in the hospital.
In other exciting news for cystic fibrosis patients, there's a new drug recently FDA approved, and it's available for people 12 years of age or older, and it significantly improves lung function. St. Luke's was a research study site, so some of their patients have already been on the new drug for a few months. Reporting in studio, Jessica Taylor, 6 on your side.